Welcome to Ask a Speech Therapist. Today's question, how long will my child need speech therapy?
This is a question I get asked often during the child's initial evaluation. Many parents want to know, how long will my child need to be in the therapy process? And this is a reasonable question. Therapy takes a lot of time, it takes money, you need to maintain consistent attendance. So it's reasonable to wonder, how long are we going to be a part of this process? Unfortunately, there's no single answer to this question. It depends on a variety of factors. And really, you should be wary of any professional that's willing to guarantee you results in a set amount of time. But the things that a therapist is going to look at are the nature and the severity of the disorder, how many goals a patient is working on. Obviously, children that have more goals and maybe a more severe deficiency in their speech and language are going to need therapy longer than a child with a mild delay that may only affect one area of his or her communication. We're also going to look at the amount of time the family has available to spend working on speech therapy assignments in between therapy sessions. It's very important that these children are exposed to these concepts over and over and over again in order for a change to truly happen in their speech. So if you think about only maybe 2 30-minute sessions per week, that's only about an hour of their waking time of that entire week. That's about 1% that they're awake, that they're actually working on speech therapy or concepts that we're working on. So if a family's able to tackle those things in between sessions, then you're going to see progress faster for most kids. Other things that we have to think about are there any learning or behavioral challenges that are going to get in the way of the child making progress immediately? So sometimes we need to tackle some of those things first or simultaneously. So when we take all of these factors into consideration, we still may not be able to give you a set amount of time that your child's going to need to be in therapy. But what I usually tell parents is we're definitely going to monitor your child's progress over the next 3 to 6 months, and I'll keep an open dialogue with you about the need for continued therapy. If we get to that 6-month mark and we still have several goals to meet, then we're going to keep going. If we've met our goals and the child is at an acceptable level of improvement and there's no need for therapy, then we'll be open about the need for discharge as well.